What's up? So, I'm here at school, and I thought that we would take a look at some of these phlebotomy ideas with videos since unfortunately you guys cannot be at school. So, I'm going to walk you through kind of how to do the major things that are talked about in your notes, and we'll keep our fingers crossed that maybe we will get to actually get back in here before the end of the year and you guys can play with these practice arms a little bit. So, let's go over to the lab. Alright, here we are, slowly struggling to make it here by the 8 a.m. bell, or maybe for Tori it's more like down here. Here we are, trying to get here by the 8 a.m. bell, and then I'm still out in the hallway if I'm some of you guys at 8 o'clock, and then I burst through. So here we go. Here's the lab. Hasn't changed much since you were last here. It's still a mess. And here is our clinic. With our arm set up with an IV and all kinds of stuff going on. And so we'll come back to that in a second. And then these guys wanted to say hi. So Marvin and Stevie are here, just doing their thing, hanging out, talking to me a little bit. All our creepy axolotls are here too. So there's those guys. And it's nice and rainy outside because that's basically what we've done this entire break. So, all right, let's get to the science. First thing that we are going to talk about is injections. And so I've got some stuff here. I know I'm really close to it with the camera, but it's the best I can do. Here's my little fake pad of skin that we can inject into. And first, before we even talk about injection, we want to talk about site prep, right? So I got my nice little alcohol prep pad here that I'm going to use. And there's a little picture in your notes where it shows you that there is an appropriate way to alcohol swab even. You should spend about 30 seconds doing this. And what you want to do is, if I want my injection right in the middle of this pad, I want to start there and I want to work outward in a circular motion. Now that way I'm not touching anything that I have already sanitized with my alcohol pad. And then ideally you'd let this dry, and this would dry a lot faster on real skin than it would on this little plastic skin pad that I have. But then we go to our medicines. Now, we're talking about two different types of medicine. In our cases here, two types of injections. They could be a subcutaneous injection, which subcutaneous meaning just under the skin. That's typically going to use a larger needle, maybe something like this one. And it's going to be placed under the skin. Now, also, we're on the topic of needle etiquette here. I think I mentioned this back when we were in class, but you never want to do what I was about to do and attempt to put the lid back on the needle. What you want to do instead is you scoop it off the table using the needle and then secure it. Now, the other option is an intramuscular injection. So that might use something more like this needle, which is quite a bit shorter and smaller. And this is going to be plunged directly into the muscle. Now, sometimes you can get, oops, wrong side. You can get these already filled with medicine when they come in, or you may have to fill them from a vial like this one that's just empty. So if that was the situation, what I would do is I would take my vial and I would take my needle, and I would plunge the needle just through this rubber cap. Oh, that's good. Probably should have gotten a smaller one here for this. But I would plunge that through this cap, draw up the medicine this way, try to ensure that I don't have any bubbles in there at all. So you would, you've probably seen people on TV before hold this vertically and eject some of that air. And then you're ready to go. And so if we bring back our pad, if this was going to be an intramuscular injection with this one, then it's a very dart-like motion at pretty much 90 degrees to the skin. So I'm going to take this guy, right, and just, right, and then I'm going to slowly, I'm going to slowly push my medicine out as I count to 10, and then I'm going to remove. All right, now, let's say I'm going to do a subcutaneous injection. Then I've probably got a larger needle, right? I'm going to actually pinch the skin like this, and I'm going to insert this needle into the skin. So, and then same deal, right? I'm going to release that pressure. I'm going to slowly inject my medicine over the course of about 10 seconds or less, and then I'm going to remove my needle back out. So for the rest of the procedures we're going to look at, we're going to use our phlebotomy training arm. It's a really neat device. Essentially, we hook up what appears like an IV of fake blood, which then runs through with the help of gravity our arm and causes these veins to actually have flowing blood in them. Now, this has the primary veins of the forearm in it. They're not exactly like we might expect to see in a human, but like we talked about too, a lot of times veins have different patterns in different people. But what this allows us to do is practice this procedure without having to actually stick a real person. Now, we're going to start with drawing blood. And so when we draw blood, some of you have had done before, you would go in with your patient, and one of the first things that you want to do is tie a tourniquet, right? So we talked about that in class previously, how that works. So we tied this tourniquet on here, and then that's hopefully going to distend the veins. So once we've put on clean gloves, then what we do is we will feel the veins of the arm and try to find one that we think of as bouncy. Essentially, again, it should fill with venous blood, and it'll help to have the tourniquet and to ask your patient to make a fist to get those veins distended where we can find them. Here's a better look at our arm where you can actually sort of see the veins that are in here. Typically, on a human patient, you're probably going to look for the median cubital vein. That's probably what's going to distend best in people. In the case of this model, I'm actually going to go up here on the cephalic vein of the forearm because that just is better distended in this arm here. And so again, we would take our alcohol swab and take the same approach, right? We start right in the middle, work our way out to disinfect that area. Now, typically what we would use to draw blood is a needle with a vacutainer. So this is a fairly large needle here that we would use, and then you would have a vacuum tube, right? And so you could fill a number of these up if you needed to for your patient. But essentially the way this works, right, let's see if I can get this, is, this actually fits onto here with vacuum suction. And so once our needle is in place in the arm, we can add a vacuum tube. We can take this one off when it's full and add another second one if we would need to, and so on. All right, so at this point, our patient is prepped. We've got our area here, like I mentioned, the cephalic vein of the forearm that we've disinfected. It's nice and bouncy because I've got this tourniquet tied up in here. Again, I don't want to lead you astray here, so since I just touched it, I should probably have that alcohol swab again. And what I want to do is with my opposite hand, so for me to be my left here, I'm going to support the vein. I'm going to anchor the vein below the venipuncture site. So my hand here is closer to the dummy's hand right now. So I'm going to anchor it with this opposite thumb. Then I'm going to take my needle, and it's kind of hard to tell here, but a needle has a bevel, right? The opening isn't just straight across there. And so I'm going to take this needle with the bevel up. I want to make sure the bevel is up. And I'm going to go at about a 15 to 30 degree angle. And I'm going to just gently stick that into the vein. Now once that's done, I'm going to add my vacutainer. So while I'm supporting this whole needle apparatus, I'm going to plunge that vacuum container onto there. Then what I'm going to do is I'm going to release my tourniquet. Right, this is going to increase the blood flow, again for the patient here. The downside of this fake arm is it is not very pressured, so I'm probably not really going to get hardly anything into this vacuum tube at all in this kind of scenario, but maybe a little bit. And then once I'm finished, I can pop my vacuum tube off, Let's see how I did. Hey, yeah, I got a little bit there. Okay. And then what I would do is I would take some sterile gauze, and I'm gonna, as I slowly pull the needle out, I'm gonna replace it with the gauze, and I'm gonna add pressure, right? And then I'm gonna ask my patient to probably keep applying pressure to the arm so that they don't get a bleed there. The last procedure that we are going to talk about is an IV, or an intravenous infusion, which requires some different equipment. We need an IV bag. This is kind of the fake one that we get with our arm here, which is normal saline. We got this in port so that we could add medicine to it, and this out port, which will then go to the patient. Now, the way you would do that is you hook up some IV tubing. This has a spike, so it's not really sharp, but this plastic spike that can go in here. And then at the opposite end is just an opening, and we also have this rolling clamp. And so the way these work is when it's kind of unrolled, it's just free on the tube, or we roll this blue part down and it closes it off. And then the last thing in terms of equipment is an IV needle with catheter. So what you'll notice here, it's kind of hard to tell probably, but what you'll notice is I've actually got a needle with this plastic tube sleeved over it. All right, and my goal is going to be to puncture the vein with the needle and then slide this tube in place and remove the needle from their arm so that they're not stuck with a needle in their arm all that time, but they just have this plastic tube. Now this also has what's called a flashback chamber, which we hope to see a little bit of blood to let us know that we are indeed in a vein when we set one of these up. Okay, so I've got all my equipment set up here. I've hung my bag of saline, and I've plunged the spike into this out port on the bag. And what I've done is I've primed the line a little bit by squeezing this drip chamber a little bit, so you see some liquid in there. And I do all of that with the rolling clamp closed. Then I open the rolling clamp, allow the fluid to pass all the way through this tube until it comes out this end, and that way I get rid of all the air that is in there. Then I close the clamp back up again, and I'm ready to rock and roll. Now at this point it would go a lot like we were doing a blood draw. We would palpate the veins and find the best ones. On our model here, we got a pretty good one here and a pretty good one here that we could use. We would sterilize that area or disinfect it again with our alcohol swab. We would potentially put a tourniquet about 4 or 5 fingers above, so we would put a tourniquet up here on the arm. And then when we were ready, we would take our catheter needle that we have here. All right, and again, much like with drawing blood, we want to have the bevel up. We want to anchor our vein below the venipuncture site. And then again, at that 15 to 30 degree angle, we're going to enter into the vein until the catheter is in there as well as the needle. Now, if you're good at this, you can do it with one hand. I'm probably not. So we're going to push that catheter forward while we pull the needle out. Right? And that is going to leave our catheter in place and get rid of our needle. Right? So now what we would do is we would attach our tubing from our IV, like so. All right? A little hard to see at the moment. All right? And then there's a lot of different ways that you can do this. There's a lot of different products out there, but we'll just say we could put some sterile gauze on here, and we could keep that in place for our patient. Now, once that is in place, what we can do, go on the move here, what we can do is we can open up a rolling clamp, and if we've done what we should, we start to see a drip from our bag. It's a little faster than we probably wanted here, but we'll start to see this drip from our bag and know that our IV is in place. When it comes time to remove the IV line from our patient, what we're going to do is we are going to use our rolling clamp to ensure that we shut off our infusion. We're going to gently remove the tape from the tubing and from this venipuncture site while we keep all the equipment where it is. And then, just like when we drew blood, we would come in with our sterile gauze, place that on that position as we pull out that catheter, right? And again, we tape that in place and apply pressure so that they don't bleed. All right, so I hope that was way more fun than just another notes video for today, trying to break things up a little bit. I know it was more fun for me. So let me know if you have questions, and I will hopefully see you guys again very soon. Take care.